Clinical course. If not treated, cardiac amyloidosis usually gets worse over time. As myeloids build up, patients' diastolic dysfunction gets worse. Their ability to do things decreases, and they have more heart failure episodes. Complications may include atrial fibrillation, enhanced conduction disease requiring a pacemaker, exacerbating congestion, and cardiorenal interactions. As the disease progresses, fatality and a decline in function often occur. But early diagnosis and availability to therapies that change the course of the disease may make it more likely for the disease to progress slowly and for patients to have better outcomes. Medical management. The medical treatment for cardiac amyloidosis is contingent upon the specific subtype of amyloid. Transthyretin amyloidosis can be treated with transthyretin stabilizers. These stabilizers keep the transthyretin protein stable and stop amyloids from forming. Transthyretin silencers are other treatment options. Silencers lower the liver production of transthyretin. One goal of treatment is to mitigate heart failure symptoms. People with amyloid cardiomyopathy may not respond well to standard heart failure medications, including diuretics. Nursing interventions. A primary nursing intervention is to maintain fluid balance. This includes weighing the patient daily, tracking intake and output, monitoring for swelling, and checking on kidney function lab results. Patients with cardiac amyloidosis frequently exhibit preload sensitive physiology, rendering them susceptible to clinical deterioration from both fluid overload and excessive diuresis. It is also important to utilize telemetry monitoring to monitor for arrhythmias or conductive problems, which are common with patients with amyloid buildup. Nursing goals. The main goals for nursing are to maintain hemodynamic stability, avoid problems, and help patients take care of themselves. One goal is to maintain evolemia, which is shown by a stable body weight, decreased swelling, and better control of heart failure symptoms. Another nursing goal is to prevent arrhythmias and conduction problems. Also, educating patients can help them learn about how to manage their symptoms on their own. Discharge planning. To decrease the risk of readmission to the hospital, nurses need to plan for discharge. Patients should get clear instructions on how to keep track of their weight, how to take medications properly, how to follow dietary guidelines, and how to track symptoms daily. If a patient gains weight quickly, has worsening dyspnea, chest pain, syncopal episodes, new confusion, or decreased urine output, they should see a doctor immediately. Before leaving the hospital, the nurse should make follow-up appointments with cardiology or specialized amyloidosis clinics when needed. Concept map teaching tool. Concept maps serve as an educational tool to aid nursing students in comprehending the interconnections among disease pathology, risk factors, clinical manifestations, diagnostic results, and teaching approaches. Knowledge check. Educators can use knowledge assessment questions to help students remember important ideas about how to diagnose, treat, and care for patients with cardiac amyloidosis. These questions help students use what they know about theory in real-life situations.